Hello everyone, I'm Professor Mark Baines with Concordia University in Irvine, and today we're talking about exercise physiology for sport in week 10 for those in the Concordia University Master's Program. But otherwise, for anyone watching this video, the primary concepts we're going to be covering is for youth, older athletes, and female athletes specifically, and some of the challenges they undergo, as well as a few other special populations or people have special needs as it relates to activity and how it affects them from activity, as well as performance nutrition from a general sense and how to apply some basic concepts that are really important for improving, let alone maintaining and not losing performance. That being said, we're going to talk first and foremost about a couple concepts we've referred to in the past, but that we want to make sure we have clarification, understanding that you are going to see repeat concepts on a regular basis from the standpoint that there's always more information that can be gleaned from any singular concept. Reminding yourself, we should all be reminding ourselves that all this information, every bit of information we cover in exercise physiology, let alone any concept within the exercise science realm, let alone the science realm, even broader than that, is there's someone out there getting their PhD or writing an entire or running their entire career around one simple concept within the context of all the things we're talking about. So you really can't talk about any of these things too much. You just can't, because there's always more. Okay, please understand that. That's why you're going to keep seeing repeat information in some cases, but building upon that information. That said, one important concept that needs to be understood, and some people are still missing it when it comes to the course, is the recognition that whenever you increase performance as a whole in general, we're talking about VO2 max, which is one very specific area. The first thing most people tend to think is that primary performance improvements are coming from the fact that your heart is adapting to stress. Now there is some adaptation from stroke volume. That is absolutely true, and that's crucial to see improvement in VO2 max. However, the primary adaptation must come from skeletal muscle adaptation. To make it a little more clear, many people have continuously said that somehow you can get the same VO2 max results from doing a swim test versus a bike test versus a run test. That's just not true. You may have a 70, 75 outrageously high VO2 max in one of those activities, and the chances of that being consistent in another activity is extremely unlikely. We're talking about probably a greater chance of winning the lottery. Okay, a greater chance of winning the lottery. And if that's you winning the lottery, then that's probably also you winning a gold medal. It's probably you also either getting a world record or being one of the world's best in a given sport. That is not normal. There's an example in the book talking about an athlete who specifically was a runner, and basically was able to just go straight into cycling and have the same VO2 max. That's not common because it's a different mechanical motion. It's the same general concepts of knee flexion and extension, and then plantar flexion, dorsiflexion of the ankle, hip extension of the hip, as well as flexion extension going through full range. The general concepts are maybe the same, but it is not the same thing from a standpoint of primarily what you're working against. The external forces are not the same. The motion can look the same, but if the external forces are not the same, it's not going to be the same result. You're not going to get the same VO2 max across different realms of sport. That being said, what we're really seeing, why you can see performance gains in one area but not necessarily in other, because of skeletal muscle adaptation. Muscle fiber growth, but not just that, specific motor control as it relates to that specific activity in the way that it is performed, which is why, and a lot of you missed this question on your exams too, you want to have a test that tests relative to the way you train in your sport. You don't want to have someone doing a step test or a treadmill test if you can avoid it. Oh, don't get me wrong. If you have no choice, like, hey, that's what I've got. I've got steps to use. We can't go outside. It's 20 degrees, or we can't go outside because it's just not reasonable in the environment we're in, or whatnot. Fair enough. But ideally, anybody who's a basketball player, soccer player, let alone runner, basically any player that's actually playing any sport that has some endurance-related aspect to it, you want to have them running outside. That's what you want to have them doing on land. Preferably on the surface in which they train, if at all possible, would be ideal. But certainly on at least a track or a field of some kind. On the grass, perhaps, but certainly or otherwise on the track, ideally, to make it as most applicable as possible to actually see performance improvements and change. You can do it any way you want, but you're probably not going to see the same consistent performance recognition by what you're testing unless you're testing in the same way. That's really important. Yes, stroke volume can increase up to 100% VO2 max. Can doesn't mean it will. People who are untrained are going to see their stroke volume max out somewhere around 40-50% of VO2 max, which means once they reach 40-50% VO2 max, which is not a high intensity, it's not probably a high level of speed or force production, you're going to start seeing their heart rate go up significantly at that level of intensity, let alone if they go higher than that level of intensity, effort-wise from them, force output-wise from them. Heart rate's going to go up because stroke volume won't keep going up. Stroke volume may actually decrease a little bit. Okay, heart is not efficient from the standpoint of cardiac output. The stroke volume going up, it's going to make up whatever it can by getting the heart rate up higher, which is why we always come back to why would you say getting the heart rate higher is a good thing, when what you're really saying is the person lacked the capacity stroke volume-wise to be able to keep up with that level of exertion. Two people going the same speed, the reason why one person's heart rate goes up higher, skeletal muscle adaptations, the primary differentiation, secondarily, their stroke volume is also not able to match that level of activity, consequently you're seeing a rise in the heart rate. Okay, that's what we're seeing. It's going to take a while to see significant stroke volume improvement, many weeks, maybe even months, and of course dramatic improvements over years. VO2 max, as we've talked about in the past, and you had an exam question related to it. Typically speaking, you can see improvements from consistent training for 2 to 2.5 years. Some have almost made it almost to 3 years, 32 months to be actually recorded, seeing significant changes occurring over that 32-month period. Is it possible to see improvements over 3 to 5 or 10 years? Of course it is. It's talking about in general in elite level type athletes and actually controlled studies that must, as best can be controlled, to see how athletes are performing over that period of time. There's always individual variance. So we're always having that hope that maybe we've got an athlete that can do something beyond what no other athlete has. But you also have to understand that most people are within the realm of the average, and in fact, a lot of people are below that average, may not see improvements for that long a period, may not see their stroke volume rise to 100% VO2 max. Those are just possibilities, okay? And VO2 max improvement, in order to get that, to see that dramatic change, you have to see skeletal muscle adaptation, which has to occur over time. It's the neural responses, hormonal responses that are occurring in a short few weeks. You're not going to even see skeletal muscle really adapting to stress for at least 6+ weeks, where you're seeing muscle fiber growth beyond just the neural connections and better motor control or better endocrine system response relative to the level of stress that's going on at a given moment in time. Okay. That said, test frequency and selection, making sure you're assessing every aspect of what's relative to the need of your athletes. It's pretty simple if you're training a track athlete. They're either an endurance type athlete. It's not as simple for a middle distance runner because you got really significant levels of your glycolytic need as well as endurance need and speed as well. A pure sprinter, it's why would you do glycolytic test or VO2 max test, right? There's no reason for it. What people mistake as a football player, they think it's like a sprinter because you're going for short periods of time. Yeah, but then you come right back and do it again. Sprinters don't do that. They go for many minutes before they do it again, and then technically in a performance competition, they have one effort and they don't do anything for hours or maybe even days again. So it's not even close to the same thing a sprinter like a football player. Football player has a much higher level of endurance need, glycolytic need, endurance need, than does a sprinter, for sure. There are differences there. But that said, you have to really take some time to analyze not only the specific needs of your sport, but more specifically, the individual needs of your athletes. Some athletes will need more focus in other areas. You may have to have some individual one-on-one meetings to determine things they should be focusing on when they can, beyond the time you have with them, to help them understand what's really going to be needed for them as opposed to the other athletes on the team. That said, agility should be, like every test, you want to make sure you test them for every 4 weeks at the very most. I wouldn't do it more often than that. You're not going to see enough change in a short period of time. You can see improvements from week to week during the competition phase, during the high competition phase of sport in the primary season, sure. But some of those are just simply one person. The person's more rested than another. Some is they're learning the skill of how to adapt to what's going on in the environment of the sport. And some of it is actually the dynamics of how learning the plays or what have you. So many aspects that you can see performance changes in. That said, dramatic changes in actual physiological performance from a standpoint of speed, power, strength, endurance, you're not going to see for many weeks over whatever happened on a given day, assuming that was a good day. Okay. That said, though, not only when you test, but often when you train agility, anaerobic power, speed, anaerobic threshold, VO2 max, during season, your competitions are probably going to be your primary assessment. But out of season, In the postseason, right after the season's over, preseason a little bit here as well, you want to be testing as often as you feel like is necessary with your athletes. I wouldn't go as long as a 12-week time frame for assessing, with the exception of maybe from the time you finish your last competition, the end of your year, to maybe your first assessment 3 months in after the end of your season's over, to get them ready again to start getting geared up for more higher intensity type level of training. I wouldn't do that soon. But that said, after that, you're probably going to test every 4 weeks or so for a couple, 2-3 months before you start slowing down and actually broadening the time frame between assessments again as you near your season and your competitive phase of the training year. Agility itself shouldn't be trained more than once every 3 or 4 days. Same with anaerobic power and speed. Okay, can you train them more often? Sure, but you better not be expecting 90, 95 to 100% maximal force output. You won't. Get that stopwatch out there and time them. I guarantee you, after about 2 or 3 sets, you'll be lucky if you get the same results. You might see improvements from one set to second set, third set, but what that really is the person is not warmed up yet. They're just gradually getting up to a level of effort where they actually can max that 95, 100% force output. That's what you're seeing, not you're actually improving from set to set necessarily. That said, once they have achieved that really near maximal level, the chances of them being able to maintain it for multiple sets, if you're training someone in that level of focus more than maybe once, twice, or elite type people, not once, but at least twice, and definitely not more than 3 times in a given week. That assumes you're training 7 days a week pretty much, right? For elite level athletes. Twice, maybe 3 times if you're lucky for some athletes to train them in training that level of intensity, that level of expectation of force output, okay? Anaerobic threshold type work. Looking at glycolytic type work, working mostly type 2A muscle fibers. Certainly type 2X and type 1 are working, just like in anaerobic power and speed and agility and your explosive type work. You're working mostly type 2X muscle fibers, ATP, CP, creatine phosphate, and adenosine triphosphate, energy system 1 to 10-ish seconds. Okay, long rest between to get maximal force output. Go less than that as far as rest. Well, you're not going to get maximal force output. What's your goal? Anaerobic threshold, we're talking about somewhere between that, call it 85% max force output, maybe 90% on the high end for someone engaging in for about 20 seconds of maximal level of performance capabilities. They're going to get at most probably 90% force output, maybe less than that, up to probably down to about 70% force output as you engage kind of the higher levels of time, I should say, longer durations of time toward the end of glycolytic type phase as you start going more and more aerobic, closing on that 2 or 3 minute time frame. Generally speaking, I wouldn't have your work periods for anaerobic threshold type work be any more than a couple minutes. You're just getting way too much into aerobic at that point, and you're risking for some athletes being more aerobic than anaerobic around that 2 minute time frame, which is not a bad thing. Just know what you're looking to accomplish from that. Okay. And of course, your rest periods will be somewhere between 30 to 90 seconds because it shouldn't take more than 90 seconds to recover about 90% ATP for someone who's ready for that level of exertion. And of course, VO2 max stuff, which is no more than about 70% max force output, probably closer to 60-65% max force output. But of course, as you engage those force outputs for longer durations, heart rate will rise, right? Over time. Certainly will for everybody to some extent. And so that's why you see higher heart rates despite the fact that force output is lower. VO2 max type work could be every couple days. Aerobic level, lower level work could be every day, a couple times a day. But if you're looking for higher level challenge to anaerobic threshold / VO2 max improvement, and there's some fine lines and differentiation between the two. When you work on one, you're going to get some benefit in the other to some extent. Okay, to some extent, but you have to isolate specifically, focus toward VO2 max versus anaerobic threshold to really get any significant differences there. And the anaerobic threshold is going to be the shorter burst activity, okay, to really see improvement changes there. And of course, the VO2 max is going to be a little bit more toward the longer duration activity, several minutes or more, preferably probably 20 minutes or more on a regular basis for really improving VO2 max, okay. Doesn't mean we can't see improvements by doing things different than what we have with the research. But if the goal is to maximize the results, we got to pay attention to the research. Heart rate at lactate or anaerobic threshold. An deconditioned person is going to see their heart rate up being really high at only 50% VO2 max. It's going to be increasing pretty significantly high. It's not going to just be 60% max heart rate, give or take, like the numbers would tell us, generally speaking, occurs for an athlete at 50% VO2 max level effort. It's going to probably be higher than that. Their lactate threshold's not very high. They're not used to more challenging activity. What that's really telling you is one of two things. Either the person has no conditioning, they're deconditioned. They're going to spend more time at lower levels of intensity to improve VO2 max at whatever level they're at. Their VO2 max is somewhere around, that 40-50% level that we would think for someone engaging in higher level of training for a longer period of time, or more elite type athletes. So they're going to be tapping out pretty early on. We want to see them be able to perform at higher levels over time, not try to force the issue now, so lower the intensity. Or maybe it's just a bad day. Maybe the person comes back and tomorrow they can do it. I had an athlete, former athlete, who was a little older now, master's level type athlete, and they went through a bout of cancer, and they're in remission, and I trained them, and actually we were doing a kind of a warm-up type activity, and they were barely walking at about not even 4 miles per hour, and their heart rate was already 130 beats a minute, which for 4 mile per hour walk, a little bit less than 4 mile per hour walk for a 40-year-old former athlete or a fit person in general, even let alone an athlete, that's a high heart rate that should be occurring at less than 4 mile per hour walk. However, 2 days later, after getting proper recovery and rested, that day was clearly a bad day, not necessarily just poor conditioning, because 2 days later, we did the same type thing, and they were walking at a little faster than 4 miles per hour, and the heart rate was 108. So consequently, we're looking at different days, different results. That's why we remind ourselves that heart rate is a great gauge to remind us how the body's responding to stress. Make sure you're using that, let alone RPE, which we'll continue to talk about for assessing how someone's perceptions of effort are affecting them, let alone their actual objective output internally, or objective responses internally. So that lactate anaerobic threshold is going to be occurring at lower levels for people who are unfit, and it's going to be much higher levels for people who are fit. And you'll know because they're not breathing hard at a high level of exertion, high level of speed and output, and they're just not breathing hard. That's because they have a high lactate or anaerobic threshold. Remember again, lactate threshold technically occurs before the anaerobic threshold. Although we refer to them the same, they're not exactly the same. Now, percent VO2 max versus percent max heart rate relationship. We've talked about this in the past. I'll make this fairly quick, but I want to make sure we're getting some basic concepts here. Your pace at VO2 max. Well, whatever you can do for 10 to 12 minutes, continuous all-out effort for an athlete, that's your VO2 max pace. So oftentimes people say 100%, 120% VO2 max pace, 100% VO2 max pace. They're talking about the speed at which you would be going if you're going for 10 to 12 minutes, and that's what they're practicing doing interval type work. Okay? Don't confuse that with 100% VO2 max as it relates to heart rate. When we start talking about heart rate responses, we're not even referring to VO2 max anymore when we relate it to glycolytic type work or sprint type work. You can say VO2 max pace, but all right, if you're going to be someone doing glycolytic work at higher intensities, they're going to probably be a heck of a lot faster than whatever they can run for 10 to 12 minutes straight. So their pace is going to be like 140, 180% VO2 max pace. I tend to drop VO2 max reference for glycolytic type work as well as speed work. Doesn't mean you have to, but it's a different thing because VO2 max relates to aerobic capacity. And now with glycolytic work or anaerobic power work, we're doing anaerobic work. So why refer to VO2 max specifically? Just my professional preference. That said, 30 to 40% VO2 max, low level effort, heart rate's about 55-65% max heart rate, give or take. Fitter person might see a lower heart rate, unfit person might see a higher heart rate. They see the higher heart rate, they don't go higher than 30-40%. They just don't. They see a lower heart rate, maybe that person's ready to do a higher level intensity. We can go up a level. That's a possibility, okay, on that day. Doesn't mean tomorrow they can do it again, right? Their RPE is probably not going to be higher than 6. We don't want to see that. Their effort level higher than 6. They feel like it's more than a 6. I don't care what their heart rate is. Anecdotally, I'll give you an example of me. I played basketball a few days ago. I'm 48 years old, so clearly not the athlete I once was. And my heart rate one day, and I was jumping higher than I had in a while, moving well, shooting well, playing well, and my heart rate fairly easily got up to 140, but I felt good, felt real good, and I was moving really, really well. And then a few days later, I got out there on the court again. This time I felt sluggish, didn't feel good, wasn't producing as much force, wasn't moving as quickly, wasn't shooting as well, wasn't playing as well. And my heart rate actually didn't get up all that high, but I was really worn out. I think to get my heart rate up, and actually I was already in the low 130s, and I felt like, gosh, I don't feel good. I knew my heart rate wasn't high, but I also knew I just didn't have it. That's why we take into account RPE, not just heart rate. You got to include them all. We got to be really paying attention, being receptive of our athletes. We may need to have some longer talks with some athletes. When I say to you your RPE, I need you to be clear and honest with me. And over time, we're going to have to really understand what these things mean. The short term, they'll go, I feel good, I'm a 10. You see a lot of athletes, young athletes, say this kind of thing. I'm a 10. Dude, you can't be a 10 all the time. That's just not possible to get that all the time. And of course, then we actually have them exert anaerobic type power work, and they're not even near the maximal speed. You may be saying you feel like a level 10, but your body's telling us it's not ready to perform at a level 10. So your perception of what's going on and your actual ability to produce force right now are not the same thing. And that's what we're really looking for. We use both heart rate and RPE, as well as measuring force output, or possibly references to VO2 max in some work to help us understand that. Okay. In our mid-level work, 40-70% VO2 max, roughly 65 to 80% max heart rate, roughly. Definitely not more than 8 RPE. This is where your VO2 max improvement, your aerobic capacity improvement really improves. This is beyond just a recovery type workout, low-level aerobic activity, moderate-level aerobic type activity, and closing on at 70% to 80% max heart rate, somewhere in there, 70% VO2 max, you're starting to get toward high intensity for some athletes. That will be high intensity for some, which means they're probably not ready for it if that's high intensity, right? That said, and of course, as we do get into really what is referred to as typical high intensity for most athletes, is that somewhere in that 70-85% VO2 max for the endurance type athlete. Certainly 80-90% max heart rate is going to be, no matter what you're doing, you're going to see the heart rate in that range, or you're giving that kind of repeated efforts about level 9 RPE or above, or slightly around that area. You're going to see most athletes seeing the heart rate in the 80-90% of max heart rate. Even a sprint. Maybe not the first sprint. This is what throws people. The first sprint, maybe you ran at your 9 RPE, or more importantly, you ran to roughly 90% of your force output. You ran really close to your best time. You ran a 40-yard dash, and normally you run a 4.7, and you ran a 4.9, but you already only got to like 130, 135. Now you probably will see a little higher than that, but it's possible, and I have seen it before. But then you do another set, take 3 minutes off and do it again. The next set, heart rate's higher. Within a couple, 2 or 3 repeats, you're going to see the heart rate get to that range that we're talking about. Doesn't mean the first set response, but we don't want to see it get too high, and I'll guarantee as it starts climbing up, you're going to start seeing the performance going down, okay? And lastly, 85 to 100% VO2 max is roughly equivalent to that 90 to 100% max heart rate. The RPE is going to be as high as you can possibly get for the typical HIIT type work, or the absolute max output, force output wise for aerobic type power. Okay, you might have a 10 RPE doing aerobic level work. Your heart rate is going to be 100%, near 100%. Your RPE is around level 10, and referred to your VO2 max is up near maximal, but your actual force output might be about 60-65% force output. And remember, as we said before, even though it's not referred to here, force output is the primary factor we're always looking at and trying to maximize that. That's why we look at time, how long it takes you to get a given distance, or how much distance can you get a given time, how much load can you lift in an amount of time. And I'm going to encourage you for the umpteenth time to stop counting reps. Even the power stuff. Yep, don't count reps. 10 seconds. What can you do? Boom, go. That's what we're looking at. That's a much more indicative level of power than the number of reps, because there's so many variables within the number of reps as far as technique, as far as actual explosiveness. There's a lot more to it than counting a rep. And that being said, highly encourage you to go more for time, because reps are based in time. That's where it came from in the first place. That being said, strength, certainly hypertrophy, strength, and power and speed are all aspects of strength. Hypertrophy is muscle fiber growth, right? Strength is maximal force capacity we're typically talking about, actual maximal type strength. And of course, power and speed, we're talking about explosive activity. So in other words, the ability to produce a lot of force over a given distance in less time, right? That said, heart rate's not going to be necessarily indicative of your actual response in these levels of performance. So although we're still measuring heart rate, you're not going to necessarily expect to see the heart rate rise as high as it will doing our glycolytic type work or a longer duration aerobic type work. Okay. Now, and that said, heart rate should still be measured, so we know roughly speaking what the heart rate is at that given point. So next time we actually do the same level of training or drill, the heart rate should be the same or lower. If it is, with the same level of response, we're improving. Or at the same heart rate, we're getting a higher level force output, or they're going faster. That's what we're looking for. And of course, the RPE must be taken into account, as we mentioned before, because of the value it gives us for how they feel. Okay. Typically, hypertrophy type work is about 40-75 seconds work. Okay, about 60-90 seconds rest is recommended, because you don't need full ATP. You're going to need anywhere between 70-90% ATP at most. Okay, and of course the force output, this is referring to force output, is about 65-80% force output. You're not going to get more than 80% force output when you're going for 40 seconds. The majority of people. Some might, but not many. Okay, and that said, this should say strength here, maximal type strength. 1 to 40 seconds. Why 1 to 40 seconds? Well, you're in the creatine phosphate and the early phases of glycolysis, where you're still going to see maximal benefits from strength. You're looking for absolute max. Well, of course, we're going in that 1 to 10 second type range. Okay, so the power is certainly in that range, but strength, you're still getting some strength benefits there to type 2X and a little bit of type 2A fibers. Rest period, though, is going to need to be 3 to 5 minutes. If you want to get maximal output, especially if you go closer to the 1 second range versus the 40 second range, okay? And somewhere between 80 to 100% force output, okay? And of course, our maximal anaerobic type power type work, speed work, explosive stuff, 1 to 10 seconds at most. If you want to maximize that, you can argue 1 to 5 seconds for some. You could argue that. 3 to 5 minutes rest, of course, once again, and 95 to 100% force output, okay? And of course, the key factor to making HIIT work is getting your consistent intervals, being consistent from one interval into the next, and making sure we're getting the same response, not declining. We're declining at your last interval. We either programmed it poorly, or it's a bad day, or they are not conditioned for this level of work. One of the three. Okay, maybe more than one. Okay, but that said, you got to monitor mostly mechanics. Are they moving well? And you will know your athlete's about to start failing in performance when you see one of two things that come. Usually you'll see one of the two things first just by what happening, what you're looking at. Facial expression changes. Can virtually guarantee you not long after facial expression changes, performance is going to drop consistently. Someone's face looks tense, chances of them being able to produce more force, at least more force accurately, highly unlikely. You want to have someone like just exert brute force, that momentary, and they kind of bear down and give everything they got, they can produce more force. But if it's supposed to be controlled, like a punch or a proper kick, or getting proper speed or height in a jump, you better not be tense. If you're tense, you're not going to get a better response. Please don't confuse that tension-looking response in the face or tension in the body as being a positive thing. That's actually not a positive thing. It should be very brief, maximal contraction, and then relaxation both pre and post to that moment to get the maximal force output. Okay? And of course, as mechanics or facial expression is changing, we're going to see a drop in performance. Consider taking a rest at that given moment in time to maximize performance, to maximize force output, ongoing from one effort to the next. And very seldomly, you need to be doing more than 8 sets of much of anything, honestly. Is there exceptions? Always. Top level athletes. Okay? Special populations and athletic nutrition. For the female athletes, the female athlete triad, which is often referred to more as REDS, they're calling it now, for in some situations, for some circles with the International Olympic Committee, referring to the fact that men experience some of these same challenges with energy availability, some issues with bone loss, not so much dysmenorrhea because they don't have menses, they don't menstruate, right? But they have hormonal differences that can be affected by stress. So yeah, men can be affected by the same things women can, generally speaking. However, I think it bears importance when talking about this. Females are much more likely to have low energy availability from the standpoint of eating disorder type levels than men do. And a lot of it's because of psychological stress that goes on in, especially in North America, in our westernized culture, for the stress upon women for how they should look and body fat levels they should have, and body dysmorphia, whereby women have this unfortunately, some cases, athletes included, let alone general population, this idea they should look thinner, they should be thinner, they shouldn't weigh this much, this is not good, my body fat's too high, and a lot of it's not appropriate or fair. But that psychological stress plays a role. And of course we have to be talking about low energy availability and getting the proper nutrient needs. And we'll talk about carbohydrate, protein, fat, water here shortly. Bone loss, I have a bone to pick with the textbook. The textbook actually refers in your chapter, in chapter 22, referring to the idea that the only way to reduce bone mineral loss is a calcium deficiency and to eliminate the estrogen deficiency. Well, they're missing a point there. If don't have the estrogen imbalance. So consequently, we get the proper stresses. The person's not, female does not have estrogen issues, so to speak, or issues with maximizing and not having poor response with estrogen, let alone not having them decline bone mineral by getting appropriate levels of calcium. Fair enough, but here's the thing. That'll get them to normal. You cannot increase bone density without engaging in proper force, compressive force activity. You can't do it from pulling exercises. And I should quiz a bunch of you guys in your last discussion board posting talking about how do you build bone density, and the majority of you didn't get it. I've mentioned it before very briefly in one of the videos, whether you recall the video or not, but I'm saying it to you now, so make sure you get this, because I'm going to ask you again, how do you improve bone density? And you can say, I take calcium like that. Well, it's going to get you to normal. If you sit around and don't do anything, or don't engage in proper compressive force activities, let alone increasing proper compressive force activities, you're not going to see bone density increase. It's going to get you to normal and not have bone mineral loss, but you're not going to increase bone density, which is the goal. Okay? If you engage in high intensity activity and you don't engage in proper compressive forces, either too much or not enough of them, you may take all the calcium in the world. You're not going to increase your bone density. Okay, it's very important to understand that. Compressive force activity, walking, jumping, running, overhead pressing, chest pressing, anything that loads through, not across bone, but through bones, is going to build bone density, okay, if it's the appropriate level of stress. Dysmenorrhea, avoiding painful menstruation. Certainly if anyone ever experiences painful menstruation and they want some time to not be exerting at this level, I would highly recommend you listen to that and not challenge that, whether you're a male coach or a female coach. And here's the thing. I've rarely in all my years of coaching, collegiate level, high school level, junior high level, elementary kids, but junior high level from the standpoint of menstruation, right? I've never had a junior high girl or high school or collegiate girl, other than the mid-level or low-level athletes, ever come to me and actually talk about painful menstruation. They say, I'm having some trouble, I'm kind of had some pains, I don't know if I should do this today. What happens in my experience is the top athletes, female athletes, don't tell you, which is not what you want. I've actually had to stop saying, you look like you're in pain. I'm okay. Take a break, you're fine. You're going to be okay to take a break. It's going to be better for you. Go home, get some rest. I can tell you're uncomfortable. Something's not right there. I don't ask them why. I just know. I can see it in their performance, as you will when you see your athletes performing as well. This is a judgment call, of course, but certainly if they tell you that, I'm always going to honor that. The top athletes aren't going to play that one on you a lot. Your low-level athletes might play on you more than not, and you're going to have a talk with them about their seriousness with their training, if they're really making this stuff up, if it's really serious. That's a judgment call too, so be careful of that one. I wouldn't recommend you ever challenge it. Just more like, you have some, what I want you to do is to go see a doctor. If you question it, then have them see a doctor about what's going on as to why they have such painful menstruation. If they say that to you, I just say, I want you to see a doctor so a doctor can let me know what's going on there, if that's really a concern for you, rather than challenging the athlete about what they're saying, if that's ever a consideration. That's not something you want to challenge. What's not mentioned by your textbook is the Q angle. It refers to knee laxity as one of the differences in women versus men, and how that doesn't have a significant difference in injury-related issues for women versus men. But it doesn't even refer to, because it's a physiology text, not a biomechanics text, the Q angle, difference in the angle from the hip to the knee in the large majority of women is different than in men, because of the pelvic girdle, because of childbearing ability later on in life, or maybe at this point in time for that particular individual. They're going to have a wider pelvic girdle relative to the knee, and that is absolute major indicator of potential knee injury, let alone ankle injury, let alone back problems because of that. Can't do anything about it. It's the way they're structured, and the more children they have, they're going to have wider pelvic girdles. It's going to happen that way. It just is what it is. That said, taking that into account, we have to have the proper strength training, proper load bearing through bones, okay, and of course proper movement skill training in general. Your textbook refers a lot to the neuromuscular training in general, and get proper training for knee-related issues, but it's not the knee we're looking at. It's the hip related to the knee, related to the ankle. That's where we're going to see the maximal differences and improvement for people who have Q angle related issues. Okay. Young athletes, the primary concern is damage to the epiphyseal plate or the growth plate, and that's only going to have from significant blunt force trauma or someone lifting with extremely poor technique at extremely high loads. Too many times we hear people say young kids shouldn't lift weights. Kids lift their bodies, they jump. Kid weighs 40, 50, 60, 70, 80, 90, 100, whatever plus pounds, and they jump and land. That's more than lifting a couple 20-pound dumbbells or 10-pound dumbbells. I guarantee on that. Doesn't mean they can't lift weights. It also doesn't mean they need to. What you really have to take into account is progression, right? Now, many of you have said, and I called you out on this, referring to we should do bodyweight training first. Disagree, okay? Disagree because lower body training, a lower bodyweight squat is less intense than loading a bodyweight squat, right? However, doing a push-up or overhead press from a body perspective, which means you upside down doing a handstand press, right? That is far more stressful than taking 5 or 10, 15, 20-pound dumbbells and pressing them, either laying back on a bench or standing doing a cable chest press. Far less stressful than a push-up or a overhead press for a handstand press. So that said, you can absolutely make exercises lighter with equipment than body weight. So I would never say body weight first. Absolutely not true. You want to find the least stressful activity that's more than they currently do. And likewise, you can argue doing a leg press or some squat type presses and some angles in which you put the body at where it's actually less stressful than a body weight squat. Okay, so that said, there's a lot of options there. Be careful what you refer to as being body weight or not body weight, being more stressful, less stressful. A lot of variation there. Okay, work durations and volume. Young athletes, we have to be very, very careful. Yes, your textbook refers to the fact that you can train young athletes like adults. That's true. And like adults, we can't overtrain them and do too much with them. No young child should ever have a stress fracture, should be having ligament pulls, muscle tears. Okay, only exception being truly high school athlete or under. If those things are happening on a regular basis, freakish stuff happens. Okay, some of which you can't control. But if enough of your athletes are having these things on a regular basis, there's something we're not doing a good job of paying attention to what's going on in performance. Unless it's a blunt force trauma. Someone dives or something lands funny. You can't control that. Someone runs into another athlete. Can't control that, right? But that said, as far as just running and jumping and that kind of thing, someone shouldn't be having any sort of major injury occur from doing that. That's related to the way we program, okay? Diabetic athletes, there's a lot of people refer to, doctors included, that diabetic athletes or diabetic individuals should be going low carb. Could not disagree more with that ridiculous idea. Okay, it has nothing to do with low carb, high carb. It's the right amount of carbohydrate for an athlete or individual. And more important than the carbohydrate is what content or where's that carbohydrate coming from. High glycemic index versus low glycemic index. You want the low glycemic index majority of the time. Complex versus simple. Complex more than simple. Whole foods versus manufactured or processed foods. Whole foods. Those kinds of things, right? And as far as that goes, I've never known anybody to have become diabetic off of eating sweet potatoes, brown rice, oats, and making all their food from them rice, brown rice, not white rice. We get into the whole issue with arsenic and rice. If you've heard that one, you're going to hear it. But that depends on where you get the rice from, depends on how you cook it. Be careful what you read. That said, carbohydrate is absolutely important for every athlete who wants to engage in higher level performance or longevity of performance. I don't care who you are. If you're going to go higher intensity, 80% plus force output, 70% plus force output, work periods of fairly high intensity for 45 seconds and beyond, give or take, that person's going to need significant carbohydrate in their diet. And we'll get more to that in a second here. Now, first of all, diabetic athletes, or any athlete who has who bonks, so to speak, and having a major issue with energy, what's the first thing they need is sugar. So if sugar is the first thing they need, why would sugar be bad for you? It's not that it's bad for you. There's a right time and a place to take it. The most important time to take it, in a blood sugar lacking blood sugar during activity, which means you take in sugar and you don't play anymore. You're done for the day, right? Or during longer duration activity of an hour or more, every 15, 20 minutes, taking in 6 to 8 ounces of a 6 to 8% carbohydrate solution, or some people say gel, so be it, during that longer activity. Your book refers to activity that even can be 30 to 45 minutes. You might want to take carbohydrate during the activity. Like, that's questionable. You certainly could, but I'm still going to recommend in most situations water. That said, you can use some dependence on the athlete themselves, for sure. But with cardiovascular exercise, someone who engages in 20 to 40 minutes every single day, rarely 40 minutes ideally, of low to moderate level intensity, right now is probably never going to see diabetes, type 2. Okay? Type 1 diabetic means they're born with it. Okay? They're going to be better controlling blood sugars by getting the proper level of exertion. I've seen many, many non-athletes, not even athletes, and athletes who regularly engage in cardiovascular exercise have less need to take insulin. Okay? That's how helpful it can be, but it has to be the right intensity, like every person, with more focus for a diabetic type athlete. But please, none of this, they got to go low carb stuff. That's just not true. The right carbohydrates, the right time, even more important for a diabetic athlete than the average person. And of course, complex carbohydrates, we'll come back to, and why they're so much more significantly different than simple. Epilepsy, and we have any seizure-related issues. Volume and intensity must be modulated. If they have had epileptic attacks where they have had seizures that affect them significantly, you don't need to have doctors' recognition this person's okay to move forward with the training program. And they need to tell you they're not feeling well because we can't overly challenge such a person. They should, in most situations, unless a doctor says otherwise, be able to engage in activity like any other athlete. But you're going to need to make sure you pay attention, because the last thing you want to have them do something life-endangering like a major seizure happen. They'll probably tell you, I would hope so, they have to disclose this in their health forms when they actually ever sign up for a sport at schools. So you want to make sure you've reviewed that with the proper administration for every athlete to make sure they are healthy going into their sports field, going to their given sport season, and making sure that if anybody has epilepsy, you get a little more detail from about what's going on. Okay, but they can do anything everybody else can, generally speaking. There's just a greater risk if they proceed too high a volume, which is related to a given day or intensity. Okay. And actually, we didn't put asthma on here, but people who have asthma, they need cardiovascular exercise. You need to have some cardiovascular exercise. Doesn't mean you need to go high intensity on a given day. I've had many asthmatic clients and for personal training, as well as athletes, endurance athletes included. And the thing is, they will tell you on a given day they're not doing well. You need to make sure they're communicating with you RPE-wise, how they're feeling, and their heart rate. If their heart rate is up for an asthmatic, you don't want to overly challenge them. If the RPE is high relative to what you're expecting right now, you don't want to overly challenge them. But you're still going to need to have some cardiovascular exercise if you want to see the asthma problems improve beyond just what they do from the work they're getting or the prescriptions they're working with their doctor in regard to and other aspects of their lifestyle. Okay, older athletes. Once you gauge about 40 years old or above, VO2 max will supposedly, not everybody, about 1% every year decline. Now, can that be controlled to a certain extent with proper training? Yes, but that's really, generally speaking, what happens. For older athletes, sarcopenia, about 50 years of age, start to lose muscle fiber size. You start to lose that, okay? And after about 10 years, losing about 10%, and about 50% is due to age alone. So in other words, if you engage in regular activity, you can reduce a lot of that reduction in muscle fiber loss, reduction in force production loss, or increase force production, right? How do we do that? By never stopping training. Or if you don't train now so you don't lose too much. But that's what happens with typical older athletes, okay? And the same rules apply to them for every other athlete for how you improve hypertrophy or glycolytic level response or VO2 max, any of the above, okay? And their max heart rate is going to be different based on their age, of course. Carbs daily and during and after exercise. Your book has a fairly good number of 7 to 12 grams a day, 10 to 12 grams per kilogram per day, excuse me. And of course, that's about 55 to 65% of your diet. That's fair. Don't measure it perfectly with your athletes. Just they have to make sure they understand that close to a little over half to 2/3 of their diet should be based in carbohydrate. It's just that simple. The more they're an endurance athlete, definitely higher than 65%. More towards a power athlete, probably closer to 55%, give or take in there. Difference in higher fat needs versus carbohydrate needs, depending upon the level of performance and what's going on. Any given athlete, though, to be fair, not just based upon their sport or their given level of performance. Glycogen. Your muscles and your liver will store glycogen if you eat complex carbohydrates, enough of them with a low glycemic index, on a regular basis. You don't just carb load before you have a training session. Really, it should be about 1 to 2 hours before you train, somewhere in the range of 50 to 100 grams of carbohydrate, moderate level protein, not more than about 20, 25 grams of protein, somewhere in there at the most, and fat should be low, 10 grams or less probably prior to performance. Post-performance, relatively similar. Maybe a little higher, all depending upon for carbohydrate need. Probably not much higher than that for protein need, and definitely not that higher than that for fat need post-workout. And there are going to be some variations in that based upon size of the athlete, what they're engaging in. Are they engaging in a 4-hour workout versus a 30-minute workout? All those things have to be taken into account. But generally 1 to 2 hours before, and your book mentions 30 minutes before they got to get that carb in them right away. And that's just not true. It's actually a broader time frame. It's more like 30 minutes to about 2 hours, okay? Some would say 30 to 90 minutes. Fair enough. Go in that 60 to 90 minute time frame. Don't feel like you have to be running to the dinner table post afternoon training session to get that carbohydrate protein intake within 30 minutes after you train. It doesn't need to be that fast. Someone trying to be the elite athlete may want to be as close to that 30-minute time frame as possible. Something your book doesn't mention, however, if you go sooner than 30 minutes, sooner than about 30 to 45 minutes following activity, you can actually inhibit growth hormone. You actually can inhibit muscle fiber gain by taking carbohydrate in too soon following significant activity. If the goal is maximal power, maximizing testosterone, maximizing speed, hypertrophy, I would wait till at least 30 minutes, maybe closer to 45 minutes or more before you take in that carbohydrate post-training, okay? Protein, your body's not going to be able to fully utilize more than about 20-25 grams of protein per sitting. So I would not take in more than that. Some athletes do. They're just asking for gastric distress, either turning it into fat or excreting it. It's really what your body's going to do, okay? Or it's going to be clogging up your colon, with none of that's being a good thing. Long term, that can be problematic. Some people say that there's nothing to prove that. Well, you're just not going to see much benefit from them either. There's nothing to prove it beneficial either. So certainly wouldn't engage that for the typical athlete more than about 20-25 grams per sitting, which is the most recent research telling us is what you need. 0.8 to 1.8 grams per kilogram protein per day. And you need that for your for all cells in your body regeneration, replenishment for those cells. Energy replenishment is always going to be coming from carbohydrate. Okay, but for your cellular regeneration, cellular growth, and change, we're looking at proteins. Okay, fats. The primary job is hormone function and development of the sex hormones specifically. Otherwise, all the protein works for hormone development. But your sex hormones, testosterone and your estrogen, are all going to come, steroids, sterols, they're going to be coming more from fat, okay? And you need to be having more of your fats coming from the monounsaturated fat, which also includes polyunsaturated fat. And having more fish oil in your diet is going to be probably a maximal thing for a lot of athletes. They need to be getting that in. It's hard to get that in the diet, so oftentimes some people take supplements. Consult with a specialist dietitian on that. I completely disagree with the idea that supplementation is not necessary for most people. Actually, I think it is necessary for most people. Very few people actually maintain a proper diet of the proper foods and don't need a vitamin mineral supplement, let alone something like a proper fatty acid supplement or protein supplement, something along those lines. But that's something to look at individually for sure. Fat is probably something to be taken about 20 to 35% of your diet, whereas protein is somewhere in the range of about 10 to 35%, broad range, right? But fats are more important for low energy level exertion, for our aerobic level activity, right? Which is a lot of our day. So certainly going to see higher fat content for someone who's engaging in lower level activity throughout their day versus someone who needs higher level output for any number of reasons, including life stress and work stress, for more carbohydrate during more stressful situations. But the fats we want to try to have less of, saturated fats. Some people start saying, well, if you have free-range meats, saturated fats are fine. Within reason. Doesn't mean you can go by having free-range meats every single day. That's still high in saturated fat and not recommended. Okay, and otherwise, the ones we're really trying to avoid is the trans fats, which is processed fats. Okay, water or carb intake. The most important nutrient your body can take in is water. As little as 1 to 2% down in water intake can dramatically affect performance. If you're not urinating every 2 hours during your waking hours, not getting enough water. Urinating more than every 2 hours, you're probably getting too much, risking hyponatremia, risking washing nutrients through. Shouldn't drink more than probably 6 to 12 ounces of water with your meals because you're, again, risking washing nutrients through, risking long-term hyponatremia. One meal is not going to kill you on that, but certainly long-term is going to affect your nutrient ability to metabolize and utilize those nutrients. So drink less water during meals, drink more water between meals, be careful drinking it too close to bed to make you wake up during the night. We don't want to do that. During exercise, 6 to 8 ounces every 10 to 15 minutes. Your book refers to 5 to 10 ounces. No problem with that. 5 ounces, 6 ounces, right in that range, up to 8 or 10 ounces every 10 to 15 minutes. Okay, definitely not more than 20. You're pushing too long a period during any level of activity. It's during the hour or more activity. Definitely more the carbohydrate drink, right? And after exercise, you got to take in 1.5 to double what you lost within that 3 hours of following exercise. Starting about 30 minutes after you finish, and then every half hour or so, taking a little bit over that time, rather than trying to take it all at once. Whatever you lost. Lost 2 pounds? All right. You got to take 3 to 4 pounds of water in, which is basically 48 to 64 ounces of water. Okay, a lot of people miss that question. A lot of people miss on a regular basis how important it is to get enough water. Most people do not get enough in general, let alone during or after exercise. Pre-exercise, within about two hours out, for really intense activity or really long duration activity, 16 ounces 2 hours before, 16 ounces, maybe even more, an hour before, and maybe as much as another 60 ounces a half hour before. It depends on the person's basically excretion level, how much they tend to urinate. That's too much for some people. For some people, that's going to be everything that they need prior to going into activity. And you don't want to drink too close to your activity. It's going to affect you during the activity, right? It's a lot of stuff. A lot of things to mull over, a lot of details that are really important to longevity of performance, and that's why you got to keep going over this information again and again and again. Final thoughts for your posts. When you write those posts, when you write down anything when it comes to this research information, make sure you review it. And if you're going to be a master of this information, you have to keep reviewing it. I try to review my posts on a regular basis. I want to read yours through at least 2 or 3 times when I go over yours. We don't get better unless we review what we have done, let alone what others have done before us, right? Extra credit, those of you looking for extra credit in this course, you can write another paper, which can boost your grade up from a level of B plus to an A to an A minus, C plus to a B minus, right? We're not going to get C pluses in the course. There's no C's, D's. There's an F and there's a B minus. I know it sounds imposing, but if you get that 5,600 points, you got no problem. You're passing the course, but there's no C's. So you got to get there. If you're afraid you're not going to get there, then do 2 things. Write another paper, same thing as before, same guidelines as before, and go back and add to your posts. But you got to tell me you're going to do this, and I wrote that in the course announcements to review that. So review that for the time frames of when you have to tell me and when you have to turn that work in. Okay? And lastly, call or email me if you have questions. As always, I don't ever want you to be disgruntled or concerned or stressed. I know it happens. It is always that way whenever you're challenged beyond what you're ready for or want to do, or things are just going so heavy with you in other areas that you're like, this is another thing that's just more stress. I get it. I understand. It's just one of those things you have to do the best you can with it. Call or email me if you have any questions or need help. Otherwise, we'll talk to you again soon.